Which now brings me to my next topic, gluten sensitivity. So again, I'm not going to beat gluten up, but here's the deal. 1/3 of people who have gluten sensitivities have no symptoms at all, not even a gastrointestinal issue. Keep in mind, 70% of our immune system hangs out in the gastrointestinal tract. This is in your small intestine and large intestine. And it's not just about taking, maybe we should have some probiotics, maybe we should eat some yogurt. But if that's what you're thinking is, that's not the right way to do it. Most yogurts have 1 probiotic. Most probiotics have 4 strains of probiotics. The research on probiotics is you must have at least 7 of the 12 research strains that actually make a difference. And you need to have in the neighborhood of 30 billion cells that go through. So if I'm just eating something or I have something that has to be refrigerated and I take it through my stomach, what's the chance that it's going to die in my stomach acid? It's like 99%. A little bit gets in, but not very much. So those 12 strains have to be put in a capsule that can get past the stomach and go set up. But wait, what if I have an autoimmune case? What if I have an infection in there? If you think about going to a parking lot at Christmas and you're trying to park at let's say a mall, most of the parking spaces are full. It's really hard. You have to drive around for a while until you find a parking spot, and it's really not very friendly, or nobody's in the Christmas spirit. This is the case in most people who have autoimmune disease or autoimmunity. If you think of what's called the hofstra in the gut, and that is where our gut comes together. This is where our digestion begins, and when you break food down, it goes through the holes. But if you have a leaky gut, you have inflammation. Well, whether it's from a virus or bacteria or fungus, yeast or parasites, or the foods you're no longer breaking down, the holes to get through are now blocked. So putting a probiotic in there is frankly asinine until we get that dampened down, and then we can put it in later. What we have to do is get the inflammation out and allow the gut to come together. I run gluten sensitivities on everybody that walks in the door, unless they're just too young, and that's not going to work for us. But we still don't want them to eat it, and here's why. I have yet to find anybody that has injected gluten into their bloodstream. I ask everybody when we have a gluten sensitivity, you didn't shoot it into your arm, right? And they're like, no. But how did it get there? If you didn't shoot it into your arm, the only other way for it to get into your body is through the gut. And gluten is a monster molecule. In order to get to the gut has to be expansive, this big. And here's the more important thing about when you have a leaky gut. Once you have a leaky gut, the proteins in the bottom of the gut that are now leaking are the same proteins as a lung, asthma, or as the sinuses, all the fun times of the year that people have allergies, or worse, the brain. The proteins look the same. So when you have inflammation down here, you have inflammation everywhere else. So gut on fire is brain on fire. So this is the big deal. We're having more and more brain issues that come up. We have more and more expression of, it's not like all of a sudden there was this gene that turned on autism, and all of a sudden there's a gene that turned on ADD and ADHD in kids. No, it's more inflammation here. We all had the same genes. We're 99.9% genetically the same anyway. They're just those particular genes that are there. And now they have the opportunity for expression because of inflammation. And one of the primary drivers of that is gluten. So I'm going to give you the history of gluten. By law, grain has to be fortified in order for us to eat it. Think about that. If you have a product, but it won't sustain life, you must fortify it to make something worth. This law passed in 1943 because grain was lacking nutrients. They had acrylamide and hydrogenated oils. So back to the history of grain. In 1850, the extraction process first began to get wheat into the food system. And this is where gluten was first identified. In 1855, the first patient of celiac or gluten intolerance was first identified. In 1892, there was a guy by the name of Ford. You might have heard of him. He started to create whole wheat cereal. Ford, yeah, cereal. In 1894, there was a gastroenterologist, and his typical patient came in because they had massive constipation. Well, most of these people were farmers, and during the winter, they hunted squirrels and picked nuts and whatever they could get their hands on. They weren't exactly getting a lot of roughage or things that can clean out the digestive system, so they were mostly constipated. He decided that he would give people a particular food that had gluten in it. His name was Dr. Kellogg. You might have heard of the company. 3 years later, there was another doctor, gastroenterologist, who created a cereal called Grape Nuts. His name was Dr. Post. This is how it was introduced into our food system over 100 years ago. In 1922, the Medical Society, our American Medical Society, went to Congress and said, this is asinine. We have to stop doing this because the people that are doing this are becoming inflamed. They had a warning versus grain. In 1931, a pediatrician by the name of Dickey first diagnosed the first patient with celiac disease. In 1932, Dr. Crohn's diagnosed Crohn's disease. In 1940, chemical fertilizers were used to increase the yield, and what that did is it put more gluten on, and they had more inflammation and more bowel issues, or bowel inflammation. It was noble because Cargill wanted to come in and feed more people. Made sense. If we can make more food, we can feed more people. I mean, this was a tough time in our country. But what it did is it made more and more gluten. In 1953, it was found that the mucosal lining was completely destroyed when you put gluten in it. So Congress acted and said, okay, well, let's find out what's going on. Not only that, there was neurological issues. People had this thing called beriberi, where they'd actually have tremors and shakes. And in the old term, schizophrenia was actually called bread poisoning, not a neurological condition, all due to gluten. So in the process, in this 1953, when Congress enacted and said, okay, we need to make sure that it's fortified with B vitamins, and then we have to make sure that there's no more of these neurological conditions coming off of it. By fortifying the food, it allowed it to dampen, but the inflammation and the gluten still remained. So the testing from 1953 for transglutaminase and what's called HLA-B27 for celiac is still what is the standard of care today. This is 1953. So in 2019, these 3 tests still exist. However, there are 120 different tests for transglutaminase or celiac-related, gluten-related testing. So when somebody comes in the office and says, I've been tested for celiac, I've been tested for gluten sensitivity, and I'm negative, I always ask him, how many tests have you run? I don't expect you to know. What we do want to look at is, here you had these 3 that are negative, but we might have 117 that haven't been tested. This does not mean you're seronegative. So when we look at gluten, we want to look at every aspect because it does go in and it causes autoimmunity. The bigger part to gluten is what's called cross-reactants. So if gluten gets into the bloodstream, as well over 75% of my patients have, it gets in there, it can not only attack the heart, it can attack the lungs, it can attack the skin, and it can go to the brain. More importantly, like for me, it went to my thyroid and started causing a problem there. That was my source for Hashimoto's thyroiditis. So while I'm not going to jump up and down or get on a bandwagon, we should be gluten-free or do this, there's a reason we want to take this pro-inflammatory, autoimmune, and brain-killing product out of our system. It doesn't have any benefit to it. What it does is it causes gastrointestinal inflammation and irritability. That's why Dr. Kellogg's and Dr. Post was using it. They wanted to take constipation and create diarrhea. That was their purpose. So in the body, when you have gluten that comes in to your bloodstream, your body says that's not supposed to be there. It makes an antibody to it. But there are what's called cross-reactant foods. So most of our gluten-free patients, we want them to be dairy-free as well. Why? Because you have the mechanisms of the gut called a permeable membrane and food going through there. So if dairy is going through there again, if I still have my stained gluten antibody and dairy looks like this, they do connect. So they're called cross-reactants. If for whatever reason we have a gluten sensitivity and we tell our patients, you, to go off of gluten and dairy for 4 weeks, if we see your antibodies come down, you and I high five and rejoice. 80% of our patients do respond for just those 2 things. The other 20% doesn't mean you're messed up or there's a problem. It just means we have to dial and run what's called a Cyrex test for cross-reactant foods. There are 20 known cross-reactants for gluten. Sometimes we just get away with, well, you know, the gluten test didn't change, but maybe let's take out corn or maybe let's take out eggs based on our clinical experience of what you said. Hey, I ate eggs and I got a rash. Okay, let's try that first and see if our gluten test comes down. So we don't always use Cyrex testing, but Cyrex testing is the most beneficial and has the best testing protocol. If we have to, if the leaky gut is so bad, if there's a leaky brain test, there's another Cyrex test that's for that. It's called permeable membrane test. We're also testing your brain. So if you have an antibody, there are 3 levels within the gut. The first level tells us that it's probably going to take us about 3 months to fix. The second level takes us between 6 to 9 months to fix, and if it's all the way down to the last level, which means it's now affecting your brain, it could take up to a year or longer. So sometimes if we're not getting our progress with our leaky gut and our inflammation, we will want to go run this test so that we know that we're on the right page. So what could make you worse? Well, there are other causes. Again, just like my son, he had a little bit of a brain trauma. It's called concussion. Sometimes it could be poor sleep. It could be poor food. It could be other things that add to your lack of intolerance. One of the biggest things is your lack of an antioxidant. So in previous videos, we've made comments about this thing called free radicals. Free radicals come and they damage your tissue, and then they actually start to damage your DNA. What turns those off is something called antioxidants. In the antioxidant / free radical world, one free radical gets suppressed by one antioxidant. When we have an autoimmune case, you're making a lot more free radicals than you can possibly make antioxidants. That means you've lost your ability to make one of the biggest antioxidants that your body makes, called glutathione. Glutathione, when we make it in the right amount, is 1,000,000 to 1. So we really want to make that glutathione work. Why? It's neuroprotective, it's DNA protective, and it's barrier, such as your gut, lung, and brain protective. Sometimes we have to use products. We might use a whey protein isolate, and why I say it's an isolate, we can't have the whey, it still has dairy. Remember, dairy cross-reacts with gluten. With the whey protein isolate, most of the dairy has been removed and it has an immune boosting property as opposed to immune suppressing. If we can't use that, and some people are highly sensitive to dairy, we have to go to what whey turns into in the liver. It turns into N-acetylcholine, which is otherwise known as NAC. So NAC helps the body make glutathione. And sometimes you can't even do that. So we have to use something called aceglutathione, trisomal, what's called liposomal. It's in a liquid glutathione. In the past, we used to try to give a bunch of glutathione or glutamine to somebody who is autoimmune, knowing that we want to make that glutathione so they stop making free radicals or at least dampen their response. That's what's driving, once the autoimmune has started, that's what's driving the inflammation. But here's the thing, glutathione is very sensitive to free radicals. You have stomach acid, which technically is acidic. So when you have that in there, it just destroys it. So we have tried things like that in the past, and if you've done that, that's probably why it didn't work. So we want to get those glutathione processes up. We want to dampen the responses of what has caused your condition, gluten being one of the biggest issue with you, and bring you back to normal.